Good morning, my name is Rachel Phelps and I'm a graduate student at the University of Maryland, Baltimore. This morning in lab we're going to be talking about doing intramuscular or IM injections into the adult. By the end of this presentation, you as the learner should be able to recognize the different parts of the syringe, be able to identify the appropriate syringes, the appropriate needles and angles for the different IM injections, as well as know the three different parts or the three different muscles to give an injection. So let's first begin with the different parts of the syringe and needle. So as you can see in the top left-hand corner, the different parts of the syringe include the plunger, the barrel, and the needle adapter. So the plunger is the end piece of the syringe that allows one to draw up medication and to administer it. It's a movable part. The barrel is the middle part of the syringe, and it is the part that contains the medication once it is drawn up. The needle adapter is the end of the syringe where you would screw on the needle of choice. As for the parts of the needle, they include the protective cover, which you will usually pull off the needle and that protects you from being stuck, the needle hub that screws into the needle shaft, the needle adapter. The shaft of the needle is the length of the needle, and then the bevel is found at the end. Later on in class, when you guys are practicing, I have an example of a filter needle, and you can see the different parts of the needle. So what is an IM injection, or where would you give it? So you give it into the muscle of somebody at a 90-degree angle. So as signified by this picture, you want to hold your needle at parallel to the skin in order to give an injection at a 90-degree angle. You want to make sure you go through one's epidermis, their epidermis, their dermis, and their subcutaneous tissue in order to get into the muscle. You want to always make sure you're getting the injection into one's muscle. With that being said, when you go to pick the length of your needle, it's based on your client. Your client's arm circumference may be thicker, one may be thinner, so you want to make sure that you're using a needle from 1 inch to 1.5 inch, but you also want to make sure that it's going to get into your client's muscle. So the thicker circumference of the arm, you may want to choose a 1.5 inch needle, whereas the thinner elderly patient's arm, you may want to use a 1 inch needle. As for the different needle gauges, when you're giving an IM injection, you can use anywhere from a 21 gauge to a 23 gauge. So even though a 21 number sounds smaller, it's a smaller number, but the diameter of the needle is bigger. Versus a 23, it's a larger number, but the diameter of the needle is smaller. And at the end of class, when you're practicing, you can see the differences in the sizes of the needles. When you're giving an IM injection, you also can give anywhere from 1 milliliter to 4 milliliters per injection. So here's an example of the different gauges of needles. As you can see, the 21 gauge needle is a smaller number, but the needle itself is bigger. And the 23 gauge, the number itself is bigger, but the needle is smaller. Appropriate sites when giving an IM injection, you want to make sure you either use the ventral gluteal, the vastus lateralis, or the deltoid muscle. The deltoid muscle is the smallest muscle out of these three, and it can only hold up to 1 ml of medication at a time. So let's first start with the ventrogluteal. So your landmark for locating this muscle is the greater trochanter of the femur, and that in this picture would be found right about here. So when you go to find that on a person, you mark it with your non-dominant hand, and then you're going to use your dominant hand to spread your fingers into a V shape to find the actual muscle, and I'm going to show you guys a video in just a few minutes of how to find that specifically. As for the vastus lateralis, that's the outside muscle on one's leg. So you divide the leg into thirds, and you want to use the middle third to give your injection. I'm also going to show you a video on that as well. The last muscle is the deltoid, and in order to find that, you would find the acromion process, signified right here in this picture. It's the bottom part of your shoulder bone, essentially. And there's a couple techniques for giving this injection, and I always find the end of the acromion process and count about my third finger down to give the injection. They want you to give it 1 to 2 inches below it. And I'm going to show you a video of a different technique as well. So now I'm going to go through and show you some video clips of each of these muscles.
Location of IM sites. Ventrogluteal injection site. Place client in side lying position. Use right hand for left anterior hip or left hand for right anterior hip. Identify greater trochanter and place palm at site. Keep palm on greater trochanter and point index finger toward client's anterior superior iliac spine and fan out other 3 fingers. Form V area with index finger separated from other 3 fingers. Inject medication at 90-degree angle within V area.
Intramuscular vastus lateralis site. When identifying the vastus lateralis injection site, the patient needs to be in either a supine or sitting position. Ask the patient to point their toes inward to rotate the hip. Divide the thigh into thirds and start at the greater trochanter and end at the lateral femoral condyle at the knee. The middle third is the site location. Medication is injected into the lateral muscle body, not the anterior thigh. Intramuscular deltoid site. Approach the patient and expose the arm to the shoulder. Have the patient flex their elbow and support the lower arm to relax the deltoid. Locate the lower edge of the acromion process. With the opposite hand, find the lateral aspect of the arm in line with the axilla. Make an upside down triangle with the hand in between those 2 points. This is the injection site.
So now you've seen a couple video clips on how to locate the different muscles to give an injection. Here in a little bit, you guys will have a chance to pair up with partners and practice finding those muscles on each other, and I'll come around if you have any questions. So let's talk about what you actually need to give an injection. You always want to make sure you're prepared before you go in your patient's room with all the supplies you need to do any type of skill. But first, you need a syringe, and again, we've talked about how you can give anywhere from 1 milliliter of a medication up to 4 milliliters of medication. Depending on the facility you choose to work at, will be based on what kind of syringe you'll find, but most facilities have a 3 milliliter syringe, and then the next one up is a 6 milliliter syringe. So if you ever had to give a 4 milliliter injection, you'd want to get the 6. Anything from 1 to 3, grab the 1. You also want to make sure you get a blunt needle to draw up your medication with. This is just one example of what they look like. And then again, you want to pick your needle size and your gauge based on the type of person you have, keeping in mind the arm circumference that we talked about, and the needle gauge as well. So again, the 21 gauge needle is a bigger diameter needle versus the 23, which is a little bit smaller. And the examples that I have that you can look at up close here soon is a 21 gauge needle, it's a 1-inch. And then we have a 22 gauge option, which is a 1.5 inch. And then we have a 23 gauge option, which is a 1 inch. Typically use the 23 gauge 1 inch option for a frail elderly patient if I'm giving an injection. And again, I'll open those up and you can see the different needle gauges here in a minute, different sizes. We're going to use the 23 gauge for our practice injections today. Always want to make sure you have a sharps container, especially if you're doing like a clinic for flu shots or something like that. You'd want to make sure you brought one. Most hospitals have them in every patient's room. Make sure you have some gloves on hand, alcohol swab, Band-Aid, and then the injection or the medication. Today we're just going to use normal saline, and we're going to practice giving an injection into an orange, as that is one of the easiest fruits to use to signify the human body for an injection. So if we're going to do this step by step, let's break it down. First, we're going to pick up our syringe, and again, we're going to use the 3 milliliter syringe for today's practice. You want to get your blunt needle again. This is everything you want to be collecting before you go into your patient's room. Then you want to pick your appropriate needle size, inch-wise, and gauge-wise. You want to make sure you have your medication that you're going to use for your injection, an alcohol swab, and Band-Aid. You're going to take all this into your patient's room. You're going to go in and wash your hands and put your gloves on. You're going to go through your 5 rights of medication administration with your patient. Typically, you're going to scan their armband, ask for their name, date of birth, allergies, etc., and then you're going to want to scan your medication prior to drawing it up. Once you've done that, you're going to want to use your blunt needle to draw up your medication. You never, ever, ever want to use the needle you're going to stick your patient with to draw up your medication. Once you're done drawing it up, you're going to take your blunt needle off, put it in your sharps container, and then you're going to recap your syringe with the needle of choice to give your injection. Next, you're going to choose your appropriate injection site based on what you've learned with each of the 3 muscles you can give an injection into. You're going to clean that site using an alcohol pad. You want to make sure you're going from the inner part of the person's site to the outer on their body. You're going to want to spread your fingers taut whenever you give an injection. So you take your index finger and your thumb and usually just spread the skin. Holding it with your non-dominant hand, and then have your injection ready in your dominant hand. Pierce the skin, and we actually aspirate IM injections unless you're at a facility that tells you otherwise. So you want to pull back slightly on your plunger, just making sure you don't see any blood return, because then you would be in a blood vessel. At that point, you would want to immediately pull your syringe out and go to a different location. But if you don't have any aspiration of blood, you want to inject your medication slowly, remove your needle rapidly. Finally, put a Band-Aid over the site. Never, ever, ever massage the site once you're done. You want to safety cap your needle, and these safety caps are the pink part of the needle, which you'll get to see here in just a second. So I'll show you in the demonstration. You'll pull the pink part away to give the injection, and then you'll hear a click whenever you put it back over the needle before disposing it in the sharp. So that's just to protect you from sticking yourself. Remove your gloves and wash your hands. So now I'm going to give you guys an opportunity to watch me demonstrate. Okay, so we've gathered our appropriate supplies. We're going to go into our patient's room and wash our hands, usually using hand sanitizer. We're going to place our gloves on. At this point, we've already scanned our patient, done the 5 rights of medication administration, and we're ready to draw up our injection. So we'll take this off. If for some reason there's not a safety cover over your medication, you want to alcohol the top. Take out your blunt syringe, or your blunt needle rather, and your syringe. Attaching the blunt needle to the syringe, you'll pull off the safety cap. Place your blunt needle into your medication. Draw up the appropriate amount. In this case, we'll draw up a 0.5 milliliter. Cap your blunt needle carefully, making sure you don't stick yourself, and place it in your sharps container. Next, you want to prepare your supplies. Preparing your patient. Have your Band-Aid ready, your alcohol swab, and then you want to recap your medication with the appropriate needle. We're going to use the 23 gauge 1-inch needle. In this case, you're going to want to pull away your safety feature on your needle and pull the cap off. Place it in your sharps container, and then you're going to clean your patient's site, going inner to outer. You're going to pull their skin taut like we talked about, and inject them on 3. 1, 2, 3. Pushing the medication slowly. Remove your needle rapidly. Safety cap your needle. Place a Band-Aid over the site and place it in your sharps container. Remove your gloves. Wash your hands. And throw your supplies, throw the rest of your trash in the trash can. Okay, so in review, now that you've seen the demonstration, we're gonna, for IM injections, you're always gonna give your injection into a muscle at a 90-degree angle, picking an 1 to 1.5 inch needle, 21 to 23 gauge, and you can give up to 1 to 4 milliliters of medication. The 3 sites are the ventrogluteal, the vastus lateralis, and the deltoid muscle. If you have any questions, let me know. At this time, we're gonna go around and practice. We're gonna pair off with your partner like we talked about, and we're gonna go through the different muscles on your partner, and then we'll pass out oranges and supplies, and you guys can practice giving an injection. And then I'll be floating around the room should you have any